When we identified the need to change how we were working across the hospital, focusing on how to make the patient journey better, how to improve patient flow, improve patient safety, it was about what options were open to us. It was a huge challenge to do for the Countess. It was a very brave decision to do. We went all in, and it was then really about getting the staff to understand and use the technology, because we knew the potential and benefits to the patients, but without the staff on board, we wouldn't realise any of those. So that was the biggest challenge, I feel. The patient is fitted with a badge. We put it around the wrist, so I guess it would be likened to a Fitbit. Once they're admitted to hospital, that's put in place, and simply we are then able to follow that patient throughout the hospital. We know their current location at any time. We can monitor where they are. Also, we have that element with staff, so we're able to see where our staff are and understand that interaction between staff and patients. So it gives us a bigger picture for the patient episode of care. It's about turning around beds quicker for patients waiting in A&E, and it's about portering being more efficient to do the job they're there to do. So an example would be on one of the care of the elderly wards, there was a 2-week period where they had a patient on the ward who was very much wanderer, didn't like to stay at the bed space and just wanted to be up walking around all day. And feedback from the staff and the ward clerk was hugely positive and said that it's given them that extra layer of safety, reassuring that they know where that patient is. And more than once, the patient's safety walkout alarm, which is through the wristband worn in with the sensors, had gone off when that patient was leaving the ward, which at times may not have been noticed in a timely manner. Also, it's about talking to patients and feeling that their journey has been smooth. They knew where they were going from A&E, they knew which bed that they were going to go, and they were on the right ward at the right time. We've had positive feedback, certainly from some specialities, that they're not having to walk around the wards now searching for their patients. They are generally tending to be within their own wards, so they're getting the right care from the right medical staff. So the coordination centre at the Countess, easy way to think about it is an air traffic control centre. So we have 2 clinical site coordinators. Previously would have been walking around the wards, trailing miles, covering lots and lots of distance from ward to ward, carrying clipboards. We now have them sat within the coordination centre. They have the teletracking screen in front of them, separated into a medical and a surgical coordinator, and they now are able to see the patients that are waiting for beds in A&E, and they are able to look and very quickly identify beds that will be coming up for that patient to go to. So really for us, the focus at the Countess now is making sure we're optimising the function of this technology. We know we're doing well in some areas, we know we're not doing so well in other areas. We have this application within theatres. It's something that has come along more kind of in the second tier of implementation, and that's something that we want to work on, and that's really about improving theatre utilisation, again, identifying where the blocks are, and also looking into how we can support not just the front door, but that back door process for discharge planning. So that's something we're exploring to help identify not just the pressures within primary care, but also within social care as well.